holidays. However, some of this is because we saw a significant drop in testing over the holidays as well. First over Christmas and then again over New Year's. So as you can see, in November, we saw a dip and then a little bit of an increase again after Thanksgiving. We've seen something very similar here following the holidays. Nothing that is significantly concerning, and we are anticipating that this number will likely flatten, hopefully, over the next week. We are currently averaging just over 1,000 new cases in Chicago residents per day, well down from the 2,400 new cases per day that we were averaging in November, but well above the 400 new cases per day, which is where we'd like to be and where we were over the summer. If we look at test positivity, again, reminder, this is the number of positive tests that are done. Our goal here as a city, ideally, would be under 5% positivity. That's that dashed line on the chart. And you can see similarly here, we saw a dip with some lower testing over the holidays. That's come up, and then just some instability there. It is flattening out. We're currently at 10.3% test positivity in Chicago residents. I will note that is below the 12% that's being discussed at the state level related to potentially being able to move out of that tier 3 mitigation over the next few weeks. Deaths also continue to improve in Chicago. We're currently averaging 13 deaths per day in Chicago residents, again above the 3 to 4 deaths per day that we were seeing over the summer, but much better than the 24 deaths per day that we saw at the peak in early December. This is not as high as we saw in our first peak, where we were averaging nearly 50 per day. So those numbers are heading in the right direction as well. And then our hospitalization numbers also are looking good. Hospitalizations continue to decline here in Chicago. Our capacity looks good. There are currently 619 patients either with diagnosed COVID or likely COVID in our non-ICUs across Chicago, and 197 patients in our ICUs. That's well down from where we were. And we have 29% ICU capacity available here in Chicago and 25% non-ICU capacity, nearly 2,000 non-ICU beds available. So feeling good about the way things are looking right now related to more serious outcomes, heading in the right direction, but still not to where we'd like to be. Then let's do a vaccine update. All of this data is available on the website. We continue to update every day, new visualizations. You can go and see data by zip code. You can see data by age. You can see broken down by first and second dose. But at the highest level, this graph shows in blue, first doses administered to Chicago residents, and in green, second doses administered to Chicago residents. As of the most recent data reported, we had 54,207 first doses that had been administered and reported, and another between 13 and 14,000 second doses. I do want to note that the data on the dashboard here does not include does not include non-Chicago residents that are vaccinated here in Chicago. So approximately 40%, between 37 and 42% of the vaccines that we're giving here in Chicago every day are going to non-Chicago residents. It's not a problem because these are people who work in our healthcare facilities here, but they don't show up in the Chicago data. And we're getting a lot of questions about why are numbers looking different, and I wanted to really highlight that right from the beginning. Also, where are we in terms of what's coming next? So we are building vaccinating partners just as quickly as we can. We started, obviously, with our 35 acute and specialty care hospitals. They were our primary focus over the first few weeks of vaccine. We also have rolled in our public safety, starting with our paramedics. We are now up to more than 250 long-term care facilities that have been scheduled for strike teams from pharmacies, working with Walgreens, CVS, and PharmScript through the federal partnership. That's skilled nursing, assisted living, and behavioral health. Also, newly, we have more than 250 vaccinating provider sites enrolled, with more being added every day. So that includes outpatient clinics like Oak Street Health. That includes our federally qualified health centers. That includes urgent care providers. And that includes pharmacies. So in addition to the ones we've been talking about just this week, we're bringing on board Jewel Osco and Walmart and Mariano's and other independent pharmacies. All of these healthcare providers, whether they are hospitals, outpatient providers, or pharmacies, are currently vaccinating first and foremost their own staff. If there are healthcare providers, and we saw, particularly in the acute care hospital setting, that there were some healthcare providers who didn't raise their hand right at the beginning, who said, I want to wait and watch some of my coworkers get their vaccine, maybe even their second vaccine. We just started second doses of vaccine here in Chicago over the last week, and I am hopeful that many people who were perhaps waiting just a little bit to watch their colleagues get vaccinated will raise their hand to get vaccine today. This works like airplane boarding. If you've missed your call to get on the plane, you haven't missed your opportunity before the plane takes off. So yes, these 1A providers, our healthcare workers, will remain top priority, and we don't completely finish with 1A before we start moving into 1B. So in addition to doing their own staff, all of these partners, our hospitals, our outpatient partners, our pharmacies, are working very hard to vaccinate our unaffiliated healthcare workers. And let me tell you, there are tens of thousands. These are our dentists, dental offices, our physical therapists, our home health aides, our dialysis centers, our mortuary folks, a whole range of outpatient providers. We are very busy and very thankful to our partners who are helping vaccinate there. And then looking ahead, not long from now, these same partners will be the ones helping vaccinate older Chicagoans. The Chicago Department of Public Health is also increasing our mass vaccination sites this week, adding additional sites, adding additional hours. Those are by appointment only for 1A healthcare workers. So broadly, we're building further opportunities to keep growing vaccine opportunities, particularly in some of our hardest hit neighborhoods, and progress has been good. With that, I will turn it over again to Dr. Ali Khan, the Executive Medical Director at Oak Street Health, who will give you some more perspective about being an outpatient provider, as well as a really important partner for us in vaccinating these 1A healthcare workers. Dr. Khan?
Thank you, Madam Commissioner, and to the entire CDPH team. It's been a privilege to work alongside all of you in this work, because I can just tell you, just as a moment of introduction, my name is Dr. Ali Khan. I'm a primary care physician and executive medical director at Oak Street Health, a network of primary care clinics for low-income seniors all across Chicagoland, where we serve 21 different communities, including 10 here in the city of Chicago. I practice in East Garfield Park, most of our clinics in Belmont Cragen, in Englewood, in Ashburn, across the city. We are working with our patients and with other community providers in some of the hardest hit neighborhoods from a COVID-19 perspective across Chicago. When the ask came from CDPH, can you help vaccinate your partners, your peers, we stepped up immediately because we felt this was a core meeting of our responsibility to help all of Chicago and all of the healthcare workers that are out there. What I can tell you from just even 2 days of doing this work is that we are nowhere close to being done with vaccinating 1A. In just 48 hours, we had over 2,600 healthcare workers across Chicago sign up to be vaccinated by us and 5 sites across Chicagoland. Within 3 hours, all 1,800 slots for vaccinations filled up. And we saw dozens of people yesterday, 300 in total. As one of the vaccinators, I can tell you, these are dentists, these are home health workers, these are therapists, these are nurses. The silent majority of people who are not affiliated with healthcare systems, who are not affiliated with the big medical centers, and who have been worrying alone, desperate to try to figure out how to get access to this vaccine. I learned later that this was all just disseminated through social media. We hadn't even gotten to the lists that CDPH and the Cook County Department of Public Health had put together of people that they've prioritized to get access to this vaccine. This is the work in front of us, and we feel that if we are going to get towards maximal impact, we have to really move both fast and slow. We have a lot of work to do with vaccine hesitancy. We know the data around how many people are asking to wait and see, or who have, historical distrust around thinking about whether a vaccine makes sense for them or not. We have to work with them in a manner that takes our time and uses trust as a tool to overcome that barrier. But at the same time, there are tens, if not hundreds of thousands of people still in Chicagoland who are our frontline workers who have yet to be vaccinated. And we have a lot of work to do for them. At Oak Street, we're here for that work. And I'm just super grateful for the opportunity to serve in this way. And we're hopeful that all of our colleagues in healthcare will do the same. Thank you.
Thank you so much. And it really is, I think, a testament to how Chicago has pulled together to see partners like Oak Street Health raise their hand. These are not healthcare providers that they had a prior affiliation with, but we are working as fast as we can to make sure our people here in Chicago who every day are potentially being exposed to COVID and keeping our healthcare system, making sure that they get their appointments booked for getting this COVID vaccine. So thank you again to you and to all of your colleagues at Oak Street Health and to the many other clinical providers that have stepped up in this massive effort. We have seen more than 8.9 million people now get their first dose of COVID vaccine across the United States. It's been going well. We have not seen unexpected results related to safety. And every day, this is getting more and more and more. We're part of this here in Chicago. I'm confident with the way our vaccine rollout has gone to date, and I'm excited by the possibility of being able to expand soon once we're able to make sure this, as you say, sort of silent majority of outpatient healthcare workers has had the opportunity to make their appointments. And with that, I'm happy to take your questions.
Okay, I'm Dana Rebick with WGN. One of my questions was, we had heard over the last several days or weeks, a week across the country, that in some areas that some doses have been at risk of spoiling. Has that happened at all in Chicago?
Yeah, absolutely not. And I appreciate that question because I do think, this is such a complicated vaccine rollout and there's a lot of different information. So let me address sort of two pieces of this. I think where people get this concern about spoilage or wastage is because we've talked a lot about the logistics of this vaccine. And as Dr. Khan and his team could tell you, particularly that Pfizer vaccine, that's the ultra cold, you take it out of the ultra cold, it's got 5 doses in that vial. You do need to use it within 6 hours of taking it out. So we are working hard to make sure that we're not wasting sort of at the 5-dose level, and we're not. But I do want people to understand that at the larger level, these vaccines can be in the ultra cold, can be in the freezers for months, 6 months. And so we are not wasting vaccine, period, in the city of Chicago. Where there is vaccine that has not been used, a good bit of it is the 74% of the Moderna vaccine that has been set aside for our long-term care facilities. That is to be used over the next few months. Again, we're not going to get through all of them before we move ahead, but we are making sure doses have been allocated. That's Moderna doses, meaning it can be in freezers, it can be there for 6 months, and there's a lot of work to make sure that no doses are being wasted. As we move ahead, our top priority is to make sure we are distributing vaccine just as quickly as it is allocated, and then working with our healthcare providers to make sure they have the planning and enough demand so that no vaccine is sitting on shelf. But most importantly, absolutely, vaccine is not going to waste.
And what's your reaction to Health and Human Services Secretary Alex Azar saying recently that he feels states have been too narrowly focused on holding back vaccine for a second dose for healthcare workers and nursing home residents who have received the first? He's saying now just go ahead and keep administering vaccines to new people. The production has ramped up, so they're confident there's enough supply for the second doses for everyone. What are your thoughts on that?
Absolutely. So let me tell you, every day right now, we're getting different information from the federal government. And it is looking promising, but I want to see actual doses allocated to the city of Chicago. I think where this is coming from is we're hearing that the incoming Biden administration has signaled that they are likely to push additional doses of vaccine to states and localities because they are feeling confident that they'll be able to ramp up that second dose. I think now perhaps the Trump administration is echoing that and saying, okay, maybe we'll start that a little bit earlier. I do think that it's been heard that we would like to have more vaccine available here quickly. We, as you saw, are really building the mechanism to have vaccinating partners. Most vaccine in Chicago, more than 90% of it, will be given through our vaccinating partners, not through the city of Chicago at mass vaccination sites. And the more vaccine we're able to receive, the more we can push out. We did a lot of work here to make sure that we have the storage capacity as needed to ensure that second dose here. We can handle more than 130,000 doses, for example, centrally of the ultra cold with Pfizer, and adding onto our hospitals, we won't have a problem. So I want to see doses allocated before I absolutely sort of make a commitment to where we're able to move on this, but I think that the language looks promising. We will make sure that we are having that second dose available. I feel really strongly about that, unless FDA or CDC guidance were to change. But I think more flexibility and more ability for us to push vaccine out faster is good news for Chicago and good news for the country.
Okay, this question is from Becky Vivea, and she's with WBEZ. She's asking how many people total, in an estimate, have been vaccinated at the city's mass vaccination site at Malcolm X, and if you have a number of roughly how many per day.
Sure. I'm not sure I have that exact number right in front of me, but we're working on getting all of this up online. We have two points of dispensing at the city level that are operating now. We have this public safety closed pod that has started with first Chicago Fire Department paramedics, and now we're doing the private EMS, emergency medical service providers, and then we'll be moving on to the emergency medical technicians within fire and continue from there. They are doing, it's a closed pod, a few hundred a day. Malcolm X, we started at a few hundred per day. We're ramping that up sort of every day. Actually, I have this in my notebook, so let me just quickly check it here. We are anticipating, I believe this week, I believe 3,300 appointments across all of the pods that are opening, with increasing to 4,875 by next week. That's what the planning team has told me. Of course, there's many pieces within that, but we are ramping up very quickly here. And again, that's only a piece of what we're doing. We are planning some further events related to the pods even later this week to talk some more about it. But let me just reiterate, those are by appointment only, for 1A healthcare workers only. So I don't want people hearing that and thinking that they can show up at the pods. But yes, we're building that capacity just as quickly as we're building our capacity for vaccinating providers.
And I think she's asking, and you touched on this a little earlier, about mass vaccination sites versus providers, pharmacies.
Yes.
When it comes time to opening this up to the general public, and you want to really blow through that population, will you consider other mass vaccination sites? I know some cities have converted or are converting sports arenas. We have Malcolm X, but are there any other
so
locations?
we are already planning, and this week we are expanding to additional large mass vaccination sites here in Chicago. We will be opening at least 2 other city colleges just this week, and we are looking at other sites, including larger sites. I'll tell you, it's partly about space, especially because we're making sure all of the safety precautions are in place, ensuring we can monitor people post-vaccine, but it's also about vaccinators. And so we've been working, for example, with many of our nursing schools and medical schools and pharmacy schools to ensure that their students with appropriate supervision can help become vaccinators. We're also really looking forward to receiving significant federal funding. We still have not received it. It's been at the high level. It's been announced that there will be vaccine money that is very much needed to be able to staff up pods and help make sure that we can do strike teams. We haven't received it yet, but as that money comes in over the next few weeks, we expect to be able to grow even further.
Okay, Craig Delamore with WBBM is asking, and I'll kind of tie in because Becky had a question I think that relates to his. How concerned are you about the numbers of people in the city and around the country still staging crowded, often maskless celebrations and gatherings? And Becky had asked too your comments, given that on this new, more contagious strain of COVID? And could that cause another spike in Chicago, do you think?
Yeah, thank you. So, yes, I didn't talk about this today because there's so much news. But certainly at this stage in Chicago, masks and social distancing have increased and not decreased in terms of their importance. You know, I've gotten my first dose of vaccine. I expect to get my second dose next week. I'm not backing off at all in terms of these other mitigation strategies, because with the amount of COVID that we are still seeing in Chicago, and you know, we're at a low percentage of Chicago that has been vaccinated. We're still learning about the possibility for asymptomatic COVID. There's a lot that's still in play. Bottom line is the way you can protect Chicago. First, get educated so that you feel confident in taking the COVID vaccine when it is your turn. But second, do not let up on these things that have gotten us this far. The data looked very good, actually, over the Christmas and New Year's holidays. We look back, we used some of that anonymous cell phone data that we used to look at mobility around the city. And a lot more Chicagoans, you know, hugely more Chicagoans stayed home compared to last year. We think that's part of why the surge is looking like it's going to be manageable. And all any of us want is to get past COVID. It's a combination of taking vaccine and doing the things that we know work. I think the way the variant will play in here, it's not, you know, the vaccine looks good against every variant that's been identified. The variants have not been shown to make people sicker. But if it turns out that, yes, this actually is more infectious, we could get to a point where we have to be, A, more careful with the things that we know work, and B, we may need to vaccinate a higher percentage of Chicago to reach that herd immunity. But we have plans going for both of those.
Okay, this is from Kelly Bauer at Black Club. She asks, if enough healthcare workers are hesitating, I think you touched on this, if enough healthcare workers are hesitating, will Chicago start vaccinating phase 1B as other Illinois health departments have done?
So we've been in close communication with the other Northern Illinois public health departments about this. We think it's important to really be able to move on this as a region to cut down on, you know, the possibility for confusion or you know, there's just a lot of moving pieces in this vaccine operation. So as our top line goals, number one, we want to get as much vaccine as we can. Number two, we want to push that vaccine out just as quickly as we can, distribute it to our providers. And then number three, we do want to make sure that the demand is there so that that vaccine can be used. So this week has been a lot about making sure those outpatient 1A providers can get access. But looking ahead here, if we get to a point where we're hearing from providers that there are vaccines that might not be used, we would probably be encouraging them to start using vaccine in their highest risk patients, the oldest patients with the most underlying conditions. But that cannot supplant the ongoing work of getting this 1A group done. So you'll be hearing more about this. Again, we'd like to see some of this federal conversation really settle out, understand what our vaccinating numbers look like. And I do just want to highlight that on the essential worker side, we don't anticipate being able to move ahead there until really into the February-March timeframe.
And then this is from Channel 7, Kate Kaguiran. I'm not sure if I'm pronouncing that correctly. She's asking about the recommendation, the lowering from 75 to 65 years old, and the Trump administration's changes with vaccine distribution, including no longer holding back second shots. She says, given the public frustration and confusion over the process on who should get the vaccine, do you feel that the federal government making these statements now is a step in the right direction to resolve the bottleneck?
So it is a time of transition in this country, I will just say, at the federal level. We are doing everything we can here to stay with the latest guidance, but also do what is best for Chicago. And again, we're working hard to make sure that this vaccine is being prioritized for those at highest risk. And so even if you think about 1A, we started with our skilled nursing facilities where we've seen the most deaths, the most cases. We're then moving on to our assisted living and then to our behavioral health and so on. On the healthcare worker side, we started with our inpatients, our hospital health workers. We've then moved to our outpatient healthcare workers and then our community-facing health workers. Similarly, in 1B, there is not going to be enough vaccine for everybody right off the bat. We're getting about 32,000 first doses of between 32 and 33,000 first doses of in Chicago right now every week. We have 360,000 Chicago residents over the age of 65, and we have hundreds of thousands of essential workers who have been in that prioritization group for 1B. So we'll be working hard to make sure and really asking all of our healthcare providers to partner with us in terms of getting that vaccine to the patients for whom it is most needed. This is going to remain, at this point, an appointment-based system. We are not planning to open up like we've seen in Florida, first come, first serve. We don't think that that is a good way to promote either equity or making sure that the people who most need the vaccine and are at highest risk for severe outcomes can get it. We're balancing all of this against, first and foremost, the desire to get Chicago vaccinated in a way that will get the city past COVID. So there are lots of moving pieces, and we're going to be giving updates probably every day or two at this point with how quickly things are choosing. Nobody in Chicago is late at this point. People think, have I missed a chance to sign up? Was there a website? No. We will let you know when we're moving. And you are welcome, if you want to use the Chai COVID Coach that we've been using all along. We'll be sending you text messages to keep you in the loop. But we are right now finishing 1A and doing that planning for 1B.
Natalie Perez with Univision asks, warehouse and factory temporary workers in Chicago and Illinois are making their cases during a press conference for priority access to get the COVID-19 vaccine. They fear being disposable from the agencies. Dr. Arwady, can you explain when those workers can expect to be vaccinated?
Yes. So it depends a little bit about how that's defined, and there's some more specific language. We are following really state and federal guidance on there. Certainly, we've looked here in Chicago at the settings, including a lot of the production settings where we've seen significant outbreaks. So just as we've worked, in 1A to say, where do we see outbreaks, where do we see risk? We've recognized that there are manufacturing facilities in particular that have been high risk for COVID. We've seen outbreaks. We know that there's ongoing risk. We also have a lot of younger, particularly Latinx workers here in Chicago that are working in those essential worker settings. And in those settings, they're in 1B. I can't speak to the whole group without knowing some of that distribution. But we all essential workers are sort of between 1B and 1C. And there have been some very specific groups prioritized in 1B as our jumpstart on the essential worker side.
Okay, I think that's all the questions I had.
All right. Thank you everybody. Yep.